So my PowerPoint is on further evidence that the measles, mumps, rubella vaccine does not cause autism. So first off, there has been enormous debate regarding the possibility of a link between childhood vaccination and the subsequent development of autism. Whether or not there is a possible link between the vaccine and autism has been reviewed extensively by independent groups of experts, and there continues to be no evidence supporting that the measles, mumps, rubella vaccine causes autism or other autism spectrum disorders. However, the hypothesized link between the MMR vaccine and autism continues to cause concern and challenge vaccine uptake. Just some general information over the measles, mumps, rubella vaccine. Basically, measles, mumps, and rubella are viral diseases that can have serious consequences, especially in children. The MMR vaccine is a live attenuated vaccine, and the components of the vaccine include sorbitol, sodium phosphate, sucrose, sodium chloride, hydrolyzed gelatin, recombinant human albumin, fetal bovine serum, other buffer and media ingredients, and then 25 micrograms of neomycin. So the initial suggestion that the vaccine might lead to autism originated in gastroenterology research conducted by Andrew Wakefield in the United Kingdom in 1998. Wakefield and his colleagues published an article claiming that the measles component in the MMR vaccine resulted in inflammatory bowel disease, which then allowed harmful proteins to enter the bloodstream and eventually damage the brain. The validity of this finding was called into question when no other researchers were able to reproduce the results. Wakefield's findings were further discredited when there was an investigation which found that he did not disclose that he was being funded for his research by lawyers who were trying to gain evidence to use against vaccine manufacturers. Because of this, Wakefield was banned from practicing in the UK, and his article was retracted in 2010. Since then, numerous studies have been conducted to further support that there is no connection between the MMR vaccine and the development of autism or autism spectrum disorders. So my first piece of evidence, this is a cohort study conducted in Montreal, Canada. There was 27,749 children involved in the study. They were born from 1987 to 1998. And they were evaluated regarding the relationship of trends in pervasive developmental disorder rates with changes in cumulative exposure to thimerosal and then trends in MMR vaccination use rates. It was found that the prevalence of pervasive developmental disorder in the thimerosal-free birth cohorts was significantly higher than that in the thimerosal-exposed cohorts. This supported that the thimerosal exposure is unrelated to increasing trend in pervasive developmental disorder prevalence. In the measles, mumps, rubella vaccination coverage decreased from 96.1% to 92.4%. In the younger birth cohorts from 96 to 98. And this actually caused pervasive developmental disorder rates to increase due to the significantly decreased MMR vaccination rates. So basically, the children that were not getting vaccinated for the MMR vaccine were actually developing these disorders more often. The pervasive developmental disorder prevalence actually increased at the same rate before and after the introduction to the second dose of the MMR vaccine, which was in 1996. So this kind of suggested that there's no increased risk of developmental disorder as a result of the 2-dose schedule before 2 years of age. My next piece of evidence is a nationwide cohort study. This was conducted in Denmark, where researchers obtained individual level information on MMR1 and MMR2 vaccinations in Danish children, and then information on autism spectrum disorder diagnoses from the Danish Psychiatric Central Register. The study actually consisted of 657,461 children born in Denmark from 1999 through 2010. Comparing the MMR vaccinated with the MMR unvaccinated children gave an adjusted autism hazard ratio of 0.93. And the study strongly supported, with significant statistical power, that the MMR vaccination does not increase the risk for autism, it does not trigger autism in susceptible children, and it is not associated with clustering of autism cases after vaccination. The highest risk for autism was actually conferred by being a boy, having no early childhood vaccinations, and having siblings with autism. And actually, the MMR vaccine actually reduced the risk for autism in girls. So another piece of evidence is a meta-analysis, which was conducted to summarize the available evidence from case control and cohort studies from Medline, PubMed, Embase, and Google Scholar. And these were all looking at the relationship between vaccine administration and the development of autism or autism spectrum disorders. It was found that there was no relationship between vaccination and autism. There was no relationship between vaccination and autism spectrum disorders. There was no relationship between autism and measles, mumps, and rubella. And there was no relationship between autism and thimerosal or mercury-containing vaccinations. So, although there's numerous other studies out there, this is just a few of them that kind of confirm that there's currently no refutable evidence that the MMR vaccine or thimerosal-containing vaccines have any kind of association with the development or onset of autism. So it's recommended that children continue to get the 2 doses of the measles, mumps, rubella vaccine. They should get their first dose at age 12 to 15 months, and then that second dose between 4 and 6 years. All right, thank you.